Hey, this is Mark Pew, and welcome to The Upload. I have the great pleasure of introducing and interviewing my friend, Dr. Geralyn Datz, who is based in Hattiesburg, Mississippi. Looking back on my notes, I think we met in 2016 at the Mississippi conference, where both of us were speaking, and we ended up having what was supposed to be a 15-minute lunch, and I think we completely whiffed the rest of the afternoon sessions because we just kept going. But Geralyn, I can't do tribute to your background as well as you can. So if you could introduce yourself to the audience, kind of give us an understanding of what you do in Hattiesburg, as well as Southeast and around the country.
Absolutely. I'm a health psychologist, which means that I treat people with medical and mental health conditions. I specialize in chronic pain and do pain psychology, which is basically a specialized form of cognitive behavioral therapy where I help people who have chronic pain develop a new mindset about their pain and develop physiological calming techniques to deal with their pain, and also help them move through their lives despite their pain. I run a clinic in Hattiesburg, Mississippi. This is where our main office is. We have satellite offices in Jackson. I'm also licensed in Louisiana and Alabama. And we see telehealth patients, which we'll be talking about probably during the podcast today. But during the pandemic, restrictions nationally have been lifted on telehealth. So we've actually been seeing clients all across the country to increase access because many clinics have closed and patients don't have access to services. I'm a past president of the Southern Pain Society, and I'm also a medical psychologist. And that is a type of specialization that in certain states like Louisiana allows a psychologist to prescribe.
Gotcha. And I know in our conversations, you probably do that very conservatively because you're not any more of a fan of letting pills take care over somebody's life than I am. So.
Absolutely. Well, the gold standard is therapy plus medication, and actually, I'm not prescribing in Louisiana yet. I'm actually prepping for my boards and should be taking those within the next couple of months. And hopefully we'll be seeing clients by the end of this year. But it's been a pretty rigorous training process and really exciting service to offer to my clients.
Well, you know, I check in with you on LinkedIn, and it seems like every 2 years you got another set of initials after your name. So just kind of how you roll.
Yes, it is. Always striving, I guess.
Absolutely. 2020 has obviously been just kind of this weird year out of left field. And it really has created a lot of issues. Shelter in place has created isolation for a lot of people. Certainly unemployment, where people thought that they were good, and then all of a sudden their business isn't there anymore or cannot open because it wasn't considered essential. Just so many different things going on associated with that. What are some red flags for you as a psychologist for mental health issues associated with COVID? And I just touched on a couple potential sources, but you know, I'm sure you've seen manifold, even more of that with the patients you've been working with since this all happened.
It's been a really tricky time. The isolation, which of course is necessary and mandated in several areas, and really in our best interest from a public health standpoint, also has the negative side effect of increasing loneliness. And that loneliness phenomenon, even amongst healthy people, meaning individuals without any mental illness or mental diagnosis, has created distress. And loneliness and isolation were actually written about in 2019. There was a fairly large public health report that came out that said there was a loneliness epidemic, which is kind of ironic. And now people are writing about the two pandemics, the loneliness epidemic and the epidemic of the coronavirus. And so, you know, the separation and the losses of jobs and the uncertainty and health anxiety have created new issues of depression and panic, fear, sleep debt amongst people who never had any issues before, but certainly individuals who already had depression, anxiety, or trauma. There's been a noticeable worsening of a lot of symptoms and a a lack of access to care. I think in terms of red flags, it's really on a spectrum, Mark. So I think, we talk about the quarantine 15, people have gained weight, but, if there's severe weight gain, if there's severe chemical coping or substance abuse, there's been an increase in domestic violence, suicidal gestures, those are all severe red flags. But also, I think it's important to understand that some psychological symptoms right now are also normal. We've worked really hard in my practice to talk with people about normalizing the feelings that are coming up, because they can feel so overwhelming for people. And that is not necessarily a sign of a red flag in terms of, a cognitive decline or something, but an understandable reaction to a real stressor.
Well, you can see one of my coping mechanisms is growing my beard hair, which is about the only thing I can control at this point. I have been reading a lot about deaths of despair, and you mentioned domestic violence increased. I've noticed, I've been reading a lot about school closures, and the fact that reporting of domestic abuse, or not domestic abuse, but child abuse, has declined. But the ERs are seeing an increase actually in the number of abuse cases coming in and the severity. So you got that. We had done a decent job in trying to reduce opioid overdoses, and had seen a decline over the past couple of years. That has ticked up now. You talked about suicidal gestures or ideation. Calls to suicide prevention hotlines have increased. And all this kind of comes from this fact of people aren't able. I've heard a lot about day drinking. You're never quite sure when you're on a Zoom call, whether either they're drinking or wearing pants. You're not really quite sure of either of those at this juncture. So, when you talk about all that all comes down to the mental aspect and the resilience that may have been diminished before this started. Maybe the fact that this just doesn't seem to end, and we had kind of hey, everything's good, let's go back to normal life, and then it ended up that normal life wasn't ready for us yet. And so now it's this interminable kind of, when is this going to end? So, especially when you're talking about chronic pain patients who historically are the primary patients, where they can't maybe access in person. I know you talked about telehealth and in person, that you got a lot of people that are requiring in person, but how has all this impacted your ability to help people with chronic pain who already have the anxiety and depression of the pain that's never going to go away potentially?
Had a huge impact. It's dramatically reduced my ability, our ability as a clinic, and I think healthcare in general's ability to address chronic pain. People have not had access to care, Mark. Early on, they couldn't get refills of medications. They weren't allowed in their doctor's offices. Outpatient procedures have been suspended in my area for a second time now, because we've had an uptick in some cases. And so getting things like injections or, a trial for a spinal cord stimulator or whatever the intervention might be, all of those things have been postponed. So in terms of our needs, our basic needs are threatened by the pandemic, and our medical needs are threatened. And so when my patients don't have the tent poles that they would normally have to keep their care plan in place, that is a real challenge. We have been there for our patients, and some have responded to telehealth, and we've treated people locally and around the country. But I think there's also, there's like a frozenness about people. There's a holding the breath and trying to, people prioritizing their own self-care is actually really hard too, because you can have chronic pain and anything. And whether you were working or not before the pandemic, everyone's felt the pinch of all of these issues. So the pandemic for us has really reduced access to care, even though we have reached many people. And we know in medical care in general, access to care has been dramatically reduced. So it's really been a challenge. And there is more chemical coping, access to alcohol and illicits. And, frankly, some of it was understandable early on because of the lack of ability to even contact a medical provider. And of course, we want to stave those things off and educate people, but without any supports, it's really a challenge.
So I know you were an early adopter of telehealth, specifically telebehavioral psychology. You were one of the first ones I talked to in regards to cognitive behavioral therapy, and you taught me a lot on how that works, both in person as well as telehealth. But telehealth obviously has gotten a steroid shot with coronavirus for people who were either who the offices were literally closed and they could not go, or they're afraid. The offices were open again, but they were afraid to go. I've heard a number of stories of people who almost died by not addressing appendicitis, by not getting that cancer, treatment, et cetera, because they literally were just afraid to leave their home or even go into the office. So, do you think psychological telehealth is here to stay? And I know it will never completely replace physical in-person psychological treatment, but do you think it's here to stay in its expanded state, and kind of give a pro or con, for staying and not?
I hope it's here to stay. My thought process on that as a frontline practitioner is I don't control that. Unfortunately, telehealth access is governed by policy and insurers. And so when President Trump made the proclamation to release from Medicare in particular, to release the restrictions from CMS, then all the other carriers followed suit. And so, not to get too technical, but I think a lot of times when people talk about telehealth access, they make it sound like it's just a wish, and it's really a legal, and there's many stakeholders with telehealth. Telehealth has been a lifesaver for us, a lifesaver for our patients, and I think it should stay. I've been doing telehealth for a long time. I started in the VA in 2004. Actually, the VA pioneered most of the telehealth that we have today. And we've been doing telehealth before the pandemic. If you lived in a rural area or what was called a micropolitan area, most insurers would allow you access to a provider who was outside your area. What the pandemic did was allow people in metropolitans, or really any area, access to telehealth. And the idea that only people in rural areas or in micropolitan areas need access to telehealth is absurd, because elderly individuals, people who have problems with transportation, people who can't drive, people who have too much anxiety or pain or other medical issues, or on dialysis, or whatever the case may be, they all have access issues, and they may be in a very populated area, and it really has no bearing. So I think one of the things that the pandemic is really showing us, Mark, is how many people need care, and that these old structures of trying to determine who really needs care and where they are really outdated. I will say, some of my clients respond fantastic to telehealth. It's great, it's portable. We have had people with internet issues, access issues. You'd probably be surprised across the United States how challenging it is. And I'm on listservs from California to New York, all the way into Florida. And everyone was commenting early on internet issues and speed. And a lot of actually internet carriers granted free access or high-speed access to areas. I'm not sure if you heard about that. And that was a really amazing coming together of resources. But we've had people drive to McDonald's and sit in the parking lot
Oh, wow.
for free internet access. because it wasn't available in their area. We've done a lot of really interesting things to overcome obstacles, and freeing up apps like FaceTime and Skype was actually really helpful, because not everyone is health literate enough to use a secure conferencing software. And so a lot of the things that the president has done has been so helpful in terms of really transforming healthcare. And I hope that leniency continues.
Yeah, and I've written on this a couple of occasions, and I really think that the consumers are going to expect this, and that a lot of the relaxation of regulations, whether it be in work comp or just general, healthcare, private pay, are going to have to maintain, because consumers just aren't going to want to spend 3 hours, 4 hours of driving to the doctor's office, waiting in the waiting room. Maybe the doctor's running late, and so they don't get seen on time, and all that, and they can do it in the convenience of their home. So I like you, I hope that the regulations will remain supportive of that. But the question, it kind of begs the question, what's going to be the outcomes? People go, okay, I've got this theory that if you want to look about what's going to be in the future, you just go back to TV series in the 1960s. Nobody would have been able to contemplate cell phones if you hadn't been prepared by Star Trek to beam me up, Scotty. And the Jetsons had telehealth from the very beginning with Elroy, who always decided that he wanted to get out of school, and they dialed up the doc on the video, screen, and he was able to diagnose stuff. So, what do you think about this from an outcome standpoint? Have you been seeing that your outcomes have been at least as good from a telephonic standpoint as opposed to in person? I know individuals are going to change. Some people do better eyeball to eyeball and that kind of stuff. But in general, are you seeing that the outcomes are similar?
Yes. Among the people who enjoy this platform and don't find it more isolating, we do know that some types of contact via video can actually increase the feelings of isolation. And you've heard these discussions of Zoom fatigue and other things. And they've been doing some preliminary studies where some people actually feel lonelier after internet contact or video contact. And that is kind of lives in the person. And I think for the people that it really feels good to, yes, the outcomes are great. We've actually been following a fair amount of folks who are waiting for bariatric surgery, because as a health psychologist, I do psychological clearances for devices and implantables and surgeries. And you can imagine how many people's surgeries have been held off because of the surgical restrictions. So people want to stay compliant, and in the case of bariatric surgery, they need to stay on an eating plan and things of this nature. And we're following a number of patients that are waiting for their bariatric surgery date, and we're checking in, and we're doing food logs online, and we're doing video chats, and they're doing great, and they like it. I will say, kind of a funny side effect is sometimes people are super casual now, and I've had people try to do therapy sessions in the grocery store, and I had a patient who was a healthcare professional actually, and she was rounding on her patients, and I had to say, hey, listen, can you please step out to the parking lot? So I think there are some occupational hazards, as it were, with this technology, but the results can be very good. And the research data says that when people opt to participate and have the buy-in, they do as well as in person. I think the one caveat is exactly what you said so well. We can't do one size fits all, and there is a lot to be said for the power of the human connection and the way that people open up in person and in the safety of a space that we need to keep in mind.
It's interesting you mentioned the casual nature of that is kind of I guess a double-edged sword. In some cases they feel comfortable, and you probably figure out stuff in the background of their either audio or their video. It's like, that was way TMI for what I needed to do, but being in person, coming to you a little bit more structured, some people like that structure. So self-motivation, obviously you don't get the number of letters after your name without some form of self-motivation and being able to accomplish stuff. How do you, in this kind of weird environment where we've got so many different things pulling at us, financial, relational, personal, oh my gosh, is this ever going to work? Is baseball going to come back? Is college football ever going to play? There's so many different things running around in our head, and then you got people who are trying to manage pain, trying to deal with substance abuse. I think that's one contributor to the deaths of despair is oftentimes people can't access their recovery. They don't have access to their 12-step programs and the accountability partners as much as they did. You got all this stuff going on. So how do you as a psychologist create a self-motivation? And this could be, in this circumstance or just in general, how do you create that self-motivation for people wanting that locus of control and actually being encouraged and being able to do it themselves?
So in order to be motivated, there's a step behind that where you have to understand what's demotivating you or stressing you out or overwhelming you. So in terms of building motivation, the first thing we have to do is to figure out what's happening with the person right then. And I call that focusing on what you can control, understanding the worries or the obstacles. I've noticed a big pattern amongst people of focusing on, I guess, concerns about things that are way outside their control or are kind of hypothetical worries. So what if I lose my job? What if I transmit the virus to someone? What if I end up on a ventilator? What if my children never go back to school? And the effect of hypothetical worries on a person's mind can be very profound because there is no answer, correct? And it leads to a phenomenon that I call analyze to paralyze. You're analyzing the situation from so many different angles, but there are no real answers. And in the end, you end up just feeling stuck, as opposed to focusing on, the worries or the issues of which you do have control over. I need to go grocery shopping. I'm concerned about catching it from someone in a store. How can I handle that today? My children's school opening has been delayed for a week. What will I do for that week? What is my worry or concern about their education? Is there something I can add in and that's personally within my domain of control to help them? I will say there's been so many resources that have outpoured in response to the worries. You mentioned recovery, and that's such an excellent point. We have a number of patients in recovery, and the use of Skype and FaceTime and online AA, NA, all the recovery meetings has been phenomenal for people and actually really helped the people who are working. I have a number of healthcare professionals, attorneys, who are in recovery and are currently working. And it was really hard for them to work their recovery program and still work. And now they can just hop on Skype and they absolutely love meeting with their sponsors. They don't have to drive, take the same time out. By the same token, there's free online classes for kids. For adults, Stanford opened up all of their courses. I mean, there's just an amazing outpouring of support for people who, want to focus on something within their control. And even Headspace came out with free access for people who want and need to learn mindfulness. So kind of circling back, one of the first things we do is focus on what you can control versus not. I spend a lot of time trying to reconnect people to their bodies, because when you get into that rumination mindset, you're very disconnected from your body. You don't know how you're thinking, feeling, whether you're tired, hungry, angry, lonely, whatever the case may be. So we have to reconnect. And then what we want to do is do some sort of committed action related to that. What is it that we can put in place today or right now? What is it? Self-care? Is it stepping back, or is it stepping forward? And, I have a tremendous amount of compassion for people who are going at this alone, because this is really hard right now. You know, this is what I've learned and what I teach people, how to change behavior and how to have insight into their thinking process. But this is by no means easy or intuitive. It's a process, and it's not even something that in the United States we're really taught. You know, we don't wake up and do Tai Chi in the mornings and go inward. We're not of the mindset that life is suffering like, you know, other cultures are. We tend to crave comfort and control. And so the pandemic has really highlighted, I think, some of our cultural weaknesses, I might say. And a way of regrouping in the face of the pandemic is to say, hey, you know, what are my values right now? What do I want to return to? My family, my workouts, my exercise. And I think that's a good place to start.
Yeah, it's really interesting of uncovering maybe some blind spots in our culture. Certainly, that has ripped the scab off of things that we thought as individuals that we had everything under control, and realized that really didn't. There are a lot of people probably that didn't realize that they were actually living paycheck to paycheck until that paycheck didn't get there. So yeah, it's interesting from a cultural standpoint. You're right. I think America. And maybe that's the reason why it's impacting us so much, although we're obviously not the only country on planet Earth that's having issues with it. So as we kind of finish things up, I know you like lists and I know you like to have actionable stuff. And resilience is a big thing that you've always talked about when we've been together, and building up that resilience, creating resilience where it may not necessarily be a strength of that person. So what are the top 1, 2, 3, 4, 5 things that you can think of that, thinking in terms of a psychologist, that you would recommend that will help build up resilience? Because we all need it right now.
We certainly do. We certainly do. And I think it's closer than we think. You know, it's a mind shift that allows people to be resilient many times. So the first thing is tolerating uncertainty. And that's what I was just touching on. We have to get good at tolerating uncertainty, or just okay with not being okay, and not pulling back from that push to know and to have a plan and to have structure when it does not exist right now. And so that's fertile ground for things like mindfulness and acceptance and reconnecting. For many people, it's spirituality. I have many clients who have found great refuge in their faith communities. Many faith communities will talk about grace, being compassionate to other people, being compassionate to ourselves, knowing that all these structures may fall, and what stands at the end. And so a big strategy that we teach is tolerating uncertainty. Another one is self-care. Connecting to yourself and knowing what you need. If you're abusing your body by eating too much or sleeping too much or too little, figuring out a way to take small steps each day. Probably the most underrated form of exercise is walking. Walking is absolutely fantastic. Biking. I went to purchase a bike recently. Did you know there's a bike shortage in the
No, really?
United
Wow.
States? Yes, it's very difficult to get a bike. So I went to my local bike store, and they are, you know, turning over bikes every day that people are bringing in and then turning out. And then there's about a 2-month wait for new bikes. So people are getting out and doing things, reconnecting with their family, using the pool in the backyard. I think this idea of self-care is tremendously important. I think also, you know, finding meaning and purpose in all of this. You know, what is the opportunity for us here? You know, if you can't work, what can you do? You know, can you take advantage of these online courses? Can you develop a new hobby? I've never heard more hammers in my entire life in my neighborhood. So a lot of people are doing things at home and building, you know, doing projects or cleaning up their backyards. And so what is the meaning and purpose for you? And I say that not just as a distraction, but like what matters. and how to reconnect with that. And these are the ways that we build resilience, because no matter where the ocean is taking us, we are steady when we can tolerate uncertainty, when we can be compassionate to ourselves and to other people. I see a lot more forgiveness lately. I see people saying, oh no, it's okay if you're late or you forgot. I see a lot more understanding. I think those are really positive things, you know, about our humanity that are coming out of the pandemic.
Gotcha. That's really great stuff, and I think, you know, the grieving process is a normal process that everybody has to go through, and in one way, shape, or form, everybody has lost something in relation to coronavirus. If nothing else, the certainty of what's to come or the status quo. Other people have lost jobs, have lost income, have lost friends and family to the disease. You know, there's so many different things, and I think what you're saying is it's normal, and to understand that you're not abnormal. It's normal to respond to circumstances like this, like that, but getting down to that self-care and that ability to offer grace and forgiveness to others, and to recognize that it's okay not to be okay, but to figure out, you know, what the new normal is and try to set that up. I think that's really, really great advice. Anything that you'd like to finish off? I always like to kind of give my guests the opportunity to speak directly to, you know, constituents, you know, to patients, to payers, you know, or payers doing what they're supposed to do in regards to paying for, you know, what's that last little Geralyn wisdom you'd like to leave everybody with before we finish up?
I would say that my hope is to continue to recognize the mental health component of healthcare and people's recovery. I do think that's another thing that has been highlighted. There's been, you know, you and I have been in the industry long enough to see different sort of spurts and zeitgeists. And I think one of the big pushes right now is to acknowledge mental health. And so don't forget about mental health. Mental health is physical health. Access to care for mental health is extremely important. Reimbursement of mental health symptoms is extremely important. It's really the foundation of everything that we do. And poor mental health leads to poor physical health and vice versa. And so to recognize that mind-body connection, I think, is really critical.
Absolutely spot on. And the good news is, I guess, that our industry, workers' compensation, has kind of figured that over the past 4 or 5 or 6 years, how important mental health is. And you're not buying psych as a compensable diagnosis if you acknowledge that mental health is a key component of it. And you've certainly been one of the big voices out in the wilderness trying to shout that. But I would hope, like you, that we don't lose the vision for that and try to go back to what we felt like was a biomedical model, without understanding the psychosocial considerations, how important mental health is. I think we're smart enough as individuals, as an industry, to recognize how important that is maintained. But you know, I know you'll continue to preach in the gospel about how important mental health is, and I will be right alongside you, trying to incorporate that message. Really appreciate you spending the time. Some great wisdom here. Not a huge surprise, because every time we've ever met, whether it's you know, over a meal or on a phone call or a conference, or there's 3 or 4 things that I immediately write down, because it's so important to realize. So I really appreciate your time. I really appreciate everything that you're doing for your patients, and for your you know, your local folks in Hattiesburg and everybody that you interact with, and wish you great mental health yourself, because sometimes being a caregiver and provider sometimes is as difficult as being the one in difficulty. So
Absolutely. Burnout is a real thing.
yeah. Well, thank you so much, Geralyn. I hope at some point in time we'll be able to be eyeball to eyeball again. In the meantime, I definitely will look forward to the next batch of letters after your name.
Well, thank you, Mark. It was a pleasure to be invited and be able to participate. And you have done a phenomenal job educating employers and payers. And I owe you a great debt, as do other mental health and medical professionals for really being a voice of reason out there. So thank you.
Well, thank you. I only know stuff because I hung out with really smart people like you. So take care.
All right, take care.
All
Bye.
righty, bye-bye.